Performing the day-to-day tasks and interventions that each patient requires during their hospital stay can become very overwhelming and too much for one nurse to handle. The delegation of certain tasks becomes an important role that the nurse must take in order to accomplish the most effective and appropriate patient care. Delegation requires a complex level of skills that nurses must use to assign each member the appropriate task. This will require a knowledge base of one's own State Nursing Practice Act and an understanding of both accountability and responsibility in order to get the job done. What is delegation? One of the most difficult responsibilities as a nurse is that of delegation because we must maintain accountability for the task assigned and be very mindful of who we give each task to in order to ensure that safe care is provided. Effective delegation involves good communication, enabling the staff to make their own decisions, and providing support on all levels of leadership for the staff making those decisions. Delegation, when used appropriately, can help to lessen the burnout, work stress, and fatigue while promoting workplace teamwork. Delegation requires a lot of follow-up and feedback to be effective, but when used in the most appropriate manner, delegation can lighten the load on everyone on the patient care team while also providing safe and effective care to each and every patient assigned. Each state has their own guidelines to adhere to when deciding what tasks can be delegated to an unlicensed team member. It's important that you stay informed on what your current state allows for delegation of tasks before deciding and assigning tasks. The Alabama Administrative Code 610611 outlines the ability to delegate certain duties and responsibilities to appropriate care team members. RNs can delegate appropriate tasks to an unlicensed team member after careful consideration is given to include factors such as what this individual's knowledge to perform the task is, their ability to perform the task, what experiences they have performing these tasks, complexities of the task, condition and health status of the patient. Things such as providing ambulation assistance while they go to the restroom, performing scheduled glucose checks, routine vital signs, recording intake and output, and bedtime hygiene are all things that are appropriate for delegation. RNs cannot delegate to an unlicensed team member tasks that require independent nursing judgment or nursing interventions, invasive or sterile procedures. Keeping in mind under the Alabama law, glucose finger sticks and phlebotomy draws are not considered invasive or sterile. Inserting IVs, inserting Foley catheters, assessing the patient's ambulation for initial assessments, operating, connecting, disconnecting IV lines, performing swallow evaluations, and central line dressing changes are all examples of things that cannot be delegated to unlicensed personnel. In order to provide the best patient outcomes possible, delegation of certain tasks is very important. As the demand for higher acuity of patients and budget confinements continues, it's important to know that your team's abilities and limits and be aware of what tasks can be delegated. Remember, it takes the entire team of healthcare workers to accomplish the best outcome for each and every patient that crosses our doorway. Good luck, my fellow nurses, and keep that teamwork flowing.